Have you ever felt dizzy, lightheaded, off balance, or a little floaty, and you notice it happens more when your neck is tight, stiff, or sore when you turn your head? Maybe you have had your ears checked already. Maybe you've been told that it's not vertigo. Maybe you notice that it only happens when you've been doing extended periods of desk work. Maybe it only comes on when you're doing computer work, driving, looking down at your cell phone, or when you wake up with a stiff neck. Today, I want to talk about cervicogenic dizziness, a type of dizziness that originates from dysfunction in the neck. But first off, this is important. Dizziness can also come from the inner ear, high blood pressure, medications, neurological issues, circulation issues, anxiety, migraines, and many other causes. So we never want to just assume that it's the neck. But for some people, the neck can be a major part of the problem. So in this video, I'll explain what cervicogenic dizziness is, what it feels like, why your neck can affect your balance system, how it's different from classic vertigo, and what you should do if your dizziness seems to be connected to your neck. Hi, I'm Dr. Rob Murray. I'm a corrective care chiropractor in Newmarket, Ontario, Canada. On this channel, I talk about neck pain, arm tingling, headaches, posture, spinal health, and how to get your body moving and feeling better. Before we get started, please understand that dizziness should be taken seriously. This video is for general education only. If your dizziness has come on suddenly, is severe, is worsening, or accompanied by other concerning symptoms, make sure to seek a health professional immediately for a professional examination. And I will go through some of those red flags later in this video. So what is cervicogenic dizziness? The word cervico refers to coming from the cervical spine, your neck. Genic means that it's originating from. So that means cervicogenic dizziness means dizziness that's originating from your neck. Most people think that balance only comes from the inner ear. And the inner ear is very important, but your balance system actually depends on your brain being able to combine information from three main areas. Number one is your inner ear or your vestibular system. Number two is your eyes. And number three is the position sensors in your joints and muscles in your neck, which tells your brain what position your head is in. Your neck is packed with thousands of these position sensors. Every time you turn your head, look up or look down, your position sensors are sending information to your brain, telling your brain what position your head is in. The theory behind cervicogenic dizziness is that when your neck is irritated, stiff, inflamed, out of alignment, the position sensors are sending information to your brain that is inaccurate and different than the information going to your brain from your eyes and from your inner ears. And when your brain receives conflicting information from these three different systems, it can make you feel dizzy, lightheaded, off balance, or unsteady. This is why some people describe their dizziness as not spinning like vertigo, but rather they feel floaty. I feel like I'm on a boat. I feel unsteady when I turn my head. My dizziness gets worse when my neck is tight. My neck pain and my dizziness seem to occur together. That pattern is one of the clues that your neck may be involved. Cervicogenic dizziness does not feel the same for everyone. Some people feel like there's a stiffness in their neck, a pressure in their head, or a headache that goes along with their dizziness. Certain patterns include dizziness that comes along with neck stiffness, reduced neck motion, irritation with motion, and symptoms that get triggered with different neck positions. For example, you might notice some dizziness when you turn your head to check your blind spot when you're driving, or you're looking up at a shelf, looking down at your phone, or rolling over in bed, sitting at a desk for too long, or after a whiplash injury. But here's the key point. Cervicogenic dizziness is only considered after other types of dizziness have been ruled out. That means if someone has dizziness, we don't just say, it's in your neck. We need to consider the inner ear, your vision system, cardiovascular issues, neurological concerns, medication effects, migraine-related dizziness, and other possible causes. This is why proper assessment matters. Now let's talk about the difference between cervicogenic dizziness and classic vertigo. Many people will use the vertigo to describe dizziness, but the true meaning of vertigo is associated with a spinning sensation, like the room is spinning around you or you are spinning. One common cause of true spinning vertigo is BPPV, which is benign paroxysmal positional vertigo. I know, it's a mouthful. BPPV often comes when crystals in the inner ear are displaced, and it can create intense spinning with certain head positions. Cervicogenic dizziness is often quite different. It will feel less like spinning and more like unsteadiness, imbalance, disorientation, and fogginess. It may also be more closely connected to neck pain, neck tightness, and neck movement. Now, this is where it gets tricky. There can be overlap. You can have a neck issue and you can have an inner ear issue at the same time. Someone can also have migraines, neck dysfunction, and vestibular issues all at the same time. So again, the purpose of this video is not to self-diagnose, but rather to give you information to let you understand that sometimes your neck can be part of your dizziness. So why can your neck affect your balance? Think of your brain like a GPS. It needs information about where your body is in space. Your eyes tell your brain what they are seeing. Your inner ear tells your brain how your head is moving. Your neck muscles and joints have sensors that tell your brain where your head is positioned. When all three systems are matched up, you feel steady and well balanced. But when your neck is stiff, irritated, guarded, or moving poorly, it might be sending confusing information. For example, your inner ears may be saying, "We're holding steady," but your irritated neck sensors may be sending different signals. This mismatch of information can cause dizziness and imbalance. This is one reason why people with cervicogenic dizziness may also have neck pain, tightness in the upper traps, stiffness at the base of the skull, reduced range of motion, or headaches. The upper neck is especially important because the muscles in the joints of the upper neck have a high concentration of sensors that send information to your brain about your head positioning. That's also why some people experience dizziness after a whiplash injury, prolonged computer work, looking down at cell phones, poor sleeping positions, forward head posture, and repetitive neck strain. Here are some situations where your neck may contribute to dizziness. Number 1, turning your head while you're driving. If you feel off balance or dizziness when you are backing up, doing a shoulder check, or turning your head quickly while you are driving, your neck mobility and control may be involved. Number 2, looking down at your laptop or your cell phone. Looking down at your laptop or your cell phone causes forward head posture, which places excessive stress on your neck joints and muscles, which in turn can cause symptoms such as headaches, stiffness, and dizziness. Number 3, looking up. When you are looking up to get something from a shelf or from your cupboards, or extend your head back to change a light bulb, or look at something in the sky, can cause dizziness for some people. This case should be assessed carefully, especially if it is consistent and intense. 4, waking up with a stiff neck. If you wake up in the morning with a stiff neck and dizziness, there's a good chance that your neck is involved in your dizziness. Number 5, a whiplash type injury. This doesn't have to be from a car accident. This can be from a fall, a sports injury, or a sudden movement. Any sudden jerking motion of the neck can cause injury to the neck joints and the muscle tendons that are trying to communicate information to your balance system. And if that is throwing off, that can cause dizziness. Because dizziness can be a sign of a more serious condition, there are times when you should be checked urgently. I would recommend getting checked urgently if your dizziness comes on very quickly and is very severe, if you feel weakness on one side of your body, if there's facial drooping, trouble speaking, you're feeling faint, you have chest pain, maybe you're experiencing a headache that is different than any other headache you've had before, your walking and coordination is off, you may have new hearing loss, or a numbness that is new or worsening. Also, if you have dizziness after a severe fall, an accident, or a head injury, that would be a good time to get assessed. The basic rule is this: if you have dizziness that's unusual, sudden, severe, or scary, don't try to stretch it out, don't try to work your way through it. Get evaluated. What can you do if your dizziness seems to be related to your neck? First, don't force aggressive neck stretches. A lot of people with neck-related dizziness will try to stretch harder and harder to get better results, but if your neck is already irritated, it could further worsen your symptoms. My recommendation is to start gently. Here are 3 ideas for things that you can do. Number 1, let's reset your posture. Stand tall. Bring your head back over your shoulders and bring your shoulders back and let them relax down. Don't jam your chin back. Don't force it. Just think of getting taller through the neck area. Now hold that for a few seconds and breathe slowly and repeat this a few times a day. Number 2 is we can do gentle neck range of motion. So start by turning your head slowly to the right. Don't force the motion too far. Do not push into your dizziness. If you feel symptoms coming on, slowly return back to neutral, then go to your left. Same idea, nice, gentle, slow motion. If your dizziness exacerbates, Don't force into it, just slowly return back to neutral. This is supposed to be a slow, controlled movement. Don't crank your neck around or make sudden, jerky movements. The goal is to retrain your neck joints to move smoothly and comfortably within that normal motion. Number 3, let's remove the daily irritants to your neck. This is more about getting to the root cause of why your neck is having issues. If your neck is constantly being irritated by looking down at your cell phone, looking down at your laptop, having poor desk ergonomics, poor driving posture, or a really old pillow, these exercises may not be enough. You need to change the positions that keep triggering these problems. Let's raise your computer screen. You can place your desktop monitor on a pile of books to raise it up, or you can take your laptop and put it on top of a laptop stand. Let's bring your cell phone up closer to eye level by resting your elbows on your sides when you're reading, or doing the one hand hold underneath your armpit. Avoid sitting in one position at work for hours on end. Follow the 20-20 rule. Every 20 minutes, get up for 20 seconds, move around, focus on something different, and then resume your work. Make sure that your pillow is supporting your neck at night, but not pushing your head forward, and consider the possibility that if your pillow is older, that you may need a new pillow. With cervicogenic dizziness, the daily habits often matter just as much or more than your exercises. For some people, home care is not enough. If your dizziness continues to come back and is affecting your quality of life, affecting your walking, your driving, your ability to work, and your confidence, I would highly recommend getting a professional evaluation. Treatment often depends on what's actually causing the symptoms. If your neck is part of your dizziness, treatment may involve such things as improving your neck mobility, posture correction, reducing muscle tension, strengthening deep neck stabilizers, improving the mobility of your upper back, and retraining the balance system. Some people may also need vestibular rehabilitation, especially if there's an inner ear component or a balance system component. It could be coming from headaches, or it might be a combination of all of the above. A good evaluation determines which system or systems needs to be properly treated. So here's the big takeaway. Yes, sometimes your neck can contribute to your dizziness, but cervicogenic dizziness cannot be diagnosed by simply having dizziness and a stiff neck. It's more considered when your dizziness seems to be related to your neck position and neck movement, and other causes have been properly considered and ruled out. So if you feel dizzy and you do have a stiff neck, a tight neck, a sore neck, but your dizziness also worsens with movements like turning your head to the side or looking up to get something off of a shelf, or doing computer work and looking down at your cell phone, or just with poor posture, then yes, your neck may be involved. If this sounds like what you're experiencing, go ahead and leave a comment and let me know. Does your dizziness come on with neck pain or neck stiffness or certain head positions? And if you're local to Newmarket, Ontario, and you'd like to have your neck, your posture, and your spinal function assessed, go ahead and contact me at murrayfamilychiropractic.com. My email address and clinic information is in the description below. Also, if you found this video helpful, please subscribe to the channel. I make weekly videos on neck pain, dizziness, arm tingling, headaches, and posture correction. I show simple ways that you can improve your health and feel better. Thanks for watching, and I'll see you at the next video.